Ever wonder how AI is becoming a supercharged partner for doctors, spotting diseases in scans, decoding medical texts, or even helping with diagnoses? Today, we're diving into Lingshu, a groundbreaking AI that's rewriting the rules of medical technology. Let's break down how it works, why it's a game changer, and what it means for the future of healthcare. Medical images like X-rays, MRIs, or lab reports aren't just random data. They're a complex puzzle of symptoms, history, and specialized knowledge. Traditional AI models. They're like students who have only studied the basics, but can't tackle advanced exams. They might spot a shadow on a scan, but can they explain why it matters? Probably not. That's where Lingshu steps in. Think of it as a medical prodigy trained on a curriculum far deeper than any textbook. Let's break it down. Traditional AI struggles with three big hurdles. 1. Missing the bigger picture. They focus on images but ignore lab results, patient histories, or even doctor's notes. 2. Hallucinations. They make up answers when the data is unclear, like a student guessing on a test. 3. Complex reasoning. They can't connect symptoms to a diagnosis or interpret a scan alongside a patient's medical history. So how did researchers fix this? They built Lingshu like a medical student, but with a supercharged curriculum. Instead of generic data, they fed it rich medical knowledge, textbooks, research papers, and even synthetic but realistic medical scenarios. Imagine giving an AI a medical textbook, a dictionary of symptoms, and a stack of practice cases to solve. But here's the twist. Lingshu learns in stages. First, it masters the basics, like recognizing a tumor in an MRI. Then it tackles harder tasks, like explaining why a lab result matters or generating a detailed radiology report. They employed reinforcement learning, a method where the AI learns through iterative feedback, much like a doctor refining their skills over time. The results? Lingshu crushed the competition. In tests, it outperformed top models like GPT-4 by 7.2 percentage points. It's not just about speed, it's about accuracy. For example, it can spot subtle abnormalities in brain scans, decode confusing lab results, or even generate reports that mirror a human doctor's clarity. It's like having a medical intern who's also a genius at pattern recognition. But here's the real kicker. Lingshu isn't just a model, it's part of a bigger movement. AI in healthcare isn't just about recognizing a tumor in a scan or flagging a strange pattern in a blood test. It's about context, understanding the full story behind the data. Think of it like a detective who doesn't just spot a clue, but pieces together the entire mystery. How does this work? These AI systems are trained on massive datasets. Think millions of medical images, patient records, and even research papers. They learn to spot not just individual anomalies, but the bigger picture. How a symptom might connect to a rare condition, or how a treatment could vary based on a patient's unique history. It's like giving doctors a superpower to see beyond the surface. The impact. Smarter diagnostics mean earlier, more accurate predictions. Imagine catching a disease before it worsens, or tailoring a treatment plan that fits you perfectly. But here's where it gets even bigger. This tech isn't just for well-equipped hospitals. By analyzing data from diverse populations, AI can help bridge gaps in global health, bringing expert-level insights to regions where resources are limited. So next time you hear about AI in medicine, remember, it's not just about code or algorithms. It's about transforming how we diagnose, treat, and ultimately save lives. The future isn't just smarter, it's more compassionate, more equitable, and deeply human.